Hi, thank you all for coming. This is Deborah, who, after having suffered from rosacea in her 40s, has got quite a few red spots and red veins across her cheeks and nose, which we're going to treat with the Thermavein today. Do you want to rest yourself back for me? Perfect. So I'm looking a bit strange in my polarised light headset, but it really does help me to visualise more clearly the veins I'm wanting to treat. The needle we're using is absolutely minuscule. It's about the size of a hair, and the machine's very, very easy to use. When you turn it on, it automates to the settings that you should use for facial treatments. So I always start from the outside and work my way inwards. And it's a very simple technique where I'm just going to touch the needle to the skin, and I'm pressing on a foot pedal here. Normally you can treat extremely quickly. I'm going to slow things down a little bit for demonstration purposes. What you can see, what I can see, is the veins are instantly disappearing underneath my touch. And Deborah, how does that feel to you? So she described it's not too bad, but a little bit sharp. And that's how most patients describe it. It's very, very well tolerated, especially over the cheek areas. So each press of my foot pedal is transmitting microwaves to within a very localised region of where I'm touching, within 1.5 millimetres. So you're minimising surrounding tissue trauma and selectively treating what you want to. Very precise and instantaneous results. I would say that it's a little bit more delicate around the nose area, and most patients find it a little bit more tender where you have oily skin. And in general also, a large patient population with red veins are rosacea patients, and their skin tends to be a little bit oilier and more sensitive, and they do feel it a little bit more. You can also use Thermavein for treatments on the body, for removing skin tags and age warts and Campbell de Morgan spots, for example. So we've got quite a few prominent vessels on the nose here, which I'm going to start treating now. And they just disappear in front of your eyes. You can even treat veins on the eyelid with this treatment, and veins on the septum of the nose, which makes Thermavein unique. There's no other equipment around that's delicate enough and precise enough to do both of those. Patient satisfaction rates are very high with it. It's often one of those wow procedures. They get home and look in the mirror and they're just astonished by the change. When you have red spots, which we have quite a few of on the nose here, I'm just going to clean my needle off actually. You start by treating around the outside, and you almost create a little ring around the spot, and it just melts away in front of your eyes. Anything that's red, you can treat. And I'm sure Deborah will agree, it's a little bit more uncomfortable on the nose. Yeah. So you need to make sure you're regularly cleaning your needle off, because you can quite easily get a little bit of debris on it. In a normal clinic scenario, I will only treat for 15 minutes at a time to minimise A, the strain on my eyes, but also B, to minimise tissue trauma. But when you get proficient with it, it's a very, very quick treatment to do. And I follow all of my vein treatment patients up to about 4 weeks. Some of them, if they have very diffuse vein disease, will require a second treatment. and I'll be honest about that up front. At the first treatment you can usually tell. And there'll be some patients who come back and a vessel's just a little bit persistent, or there were some very fine ones that when the patient flushes with the treatment, you sometimes can't differentiate the individual veins underneath the redness, and you may miss a small one or two, and they're very easy to treat at the follow-up appointment. Are you all right there, Deborah? Excellent. It's going very nicely. My background in medicine is as an anaesthetist, so for me, before I set up my own clinic, I felt a gap in what I was offering was a thread vein treatment, and I guess I had the privilege of seeing a lot of people without any makeup on and realised just how widespread this is. So many people have some facial thread veins, and a lot of them really dislike it. They feel they're judged, even though it's only one of many causes. One cause of facial thread veins is alcohol consumption, and a lot of people automatically feel they're judged as an alcoholic, even though I wouldn't say that's the truth. So it's a very, very popular treatment. I've treated several people who've had unsuccessful laser treatments, also very close to the eye, and I think they've been over the moon with the results of this, and also with the downtime afterwards, because a lot of laser treatments carry significant downtime. With this, you may crust a little bit over the treated areas during the first week, and patients need to avoid anything that's going to dilate the vessels, so any intense exercise, anything that's going to make them hot, any sun exposure, for about a week after treatment. But apart from that, there isn't any real downtime with this. They don't look like they've been punched in the face. And I recommend using a camouflage foundation, which I use Leica gel, and when they leave the clinic, most people wouldn't know they've had anything done because it's very well disguised. Very few patient contraindications. If you have a pacemaker or epilepsy and current pregnancy, and you also wouldn't want to treat anyone with fake tan on their skin. And here Deborah's actually got some very, very fine thread veins right in the eye tissue, periorbital tissue here, and I'm just treating those. Does that feel particularly uncomfortable for you, Deborah? Yeah, and it's very, very well tolerated around this area. You can also use it in combination with microsclerotherapy for some leg vein treatments, but where the skin is thicker and you've got more of an impact from gravity, you need to treat more frequently, and it will be a little bit more persistent than